Hello, my name is Michael, and today's presentation is going to be done by Hannah Hewen, myself, Kaylina Ko, and Arlene Yoon. And we're going to talk about AI use in emergency rooms, a process improvement approach. So let's talk about the introduction. So, AI in healthcare. So, AI is artificial intelligence, which refers to the use of advanced algorithms and machine learnings to improve various healthcare processes. That can include patient triage, which is to see which patients deserve the most attention first, to diagnosing in a very complicated and stressful environment like the ER. So AI can assist in decision making by analyzing large amounts of data quickly and accurately. So, the purpose of this project is to explore how AI can be used in emergency rooms in Washington state to improve efficiency, reduce waiting times, and enhance patient care. So, why AI in emergency rooms should be considered important? It's because ERs, emergency rooms, are often overwhelmed with patients, leading to delays in care, misdiagnosing, and inefficient processes, especially due to the lack of communication in such a stressful environment. So, AI can definitely help to streamline these processes, making ERs much more efficient and responsive. So let's take an approach of root cause analysis to AI and the ER. So let's talk about those common ER inefficiencies. So long wait times. So patients may wait hours for triage or care due to high patient volumes. That can lead to a very stressful environment for something as simple as a broken arm, which needs an x ray to properly be diagnosed. Patients can be waiting in rooms for a significant more amount of time than they should. They can be misdiagnosed due to the fast paced nature of the emergency rooms. There can be errors or improper tests used due to physicians being overwhelmed and making poor decisions. And there can be delays in care. So, this can be due to issues in diagnosing or treatment, which can really affect patient care and patient outcomes in the long term. So, AI can really help with triaging patients quickly. It can prioritize those who need urgent care and assist healthcare professionals in, diagnosing conditions with higher accuracy, which will help reduce delays and improve overall quality. Kind of the most important asset that AI would give is be able to deal with those large amounts of data and be able to find the easiest way to process it and improve in all these inefficiencies. So let's talk about more of that.
Hello, everyone. My name is Kaylina, and I'll be talking about the different uses of AI in an emergency room setting. AI can be used to predict risk scores and patient outcomes. UW Medicine currently uses a cost aware AI system that can predict risk scores for bleeding or mortality and various other illnesses. And this helps, it gathers all of the data that is taken on intake, usually vitals and various numbers such as that. And then it can predict in a minute or two the risk score or patient outcome. And this helps reduce efforts in trying to figure out who is more critical of a patient and speeds up treatment decisions. It can also be used to detect sepsis early. UW also uses a AI system for detecting sepsis. It is commonly missed because most patients with sepsis you don't really know until they're severely ill, and it can help improve the early detection, can help treatment decisions. AI also uses aids in medical imaging diagnosis. UW uses a system that can help use a sort of heat map to detect early spots of disease within the body that may be more critical for a radiologist to look into. And it can also help clean up image quality and reduce noise if an image is not optimal. AI can also be used to enhance triage systems. There are various different options, a few in Washington, a few in California. One is ChatGPT, another is Copilot by Google, and they are used to enhance the triage process in assessing who is more critical of a patient and helps with volume. By an article recently in this last year by Arslan and co found that triaging systems with AI outperform and more accurately help reduce um, issues compared to traditional methods such as just nurse triaging or just as we do it now. So it's definitely enhanced and it helps immensely. All right, let's take a look at our process or current system within an emergency room. First, the patient comes in for registration. They get checked in at the front desk, and documents are signed. And then they go to a triaging process where the nurse will get their chief complaint and take vitals. And then there's a waiting period. Either they wait in the lobby for a room and then to see the doctor, or they're put in a room and waiting to see the doctor in the back. Then there's physician assessment, where the doctor will come and get a full assessment of the patient and figure out what's going on, at which point they will then order either blood work or imaging that is necessary. And that is part of the diagnosis and treatment section, in which the patient will wait for labs to come back, imaging to come back, and then that will help predict what their treatment will be. And then the last part is discharge and admission. If the patient is fine and the issue is handled, they can then be discharged. If the patient then needs further care, they will be admitted upstairs. Now, AI can help in a couple different issues that come up through this process. A major one is patient volume and long wait times that result from that volume. And triaging with AI can help figure out who is a more critical patient and get through volume faster. Another part that can be aided by AI is misdiagnosis or issues in inaccuracies. And something like imaging, where they can help, AI could help narrow down exactly what it is and make a quicker diagnosis and aid the doctor in treatment decisions. I'm then going to hand this off to Arlene, and she's going to talk about Six Sigma and the tools we used to assess this.
Hello everyone, my name is Arlene Yoon. In this slide, I'll be talking about Lean and Six Sigma tools used. As a group, we collectively decided that process analytics, value stream mapping, and reduction of defects would be the operation strategy and process mapping component that we would like to use as a tool to improve standard care. Under process analytics, data would be collected, which includes patient waiting times, accuracy of triage decisions, and the time to diagnosis. Under value stream mapping, a comparison between the current state, the manual process, and the future state, which is the AI integrated process. This allows for visualizing time savings, workflow improvements in areas where AI would be most beneficial. And then under reduction of defects, AI diagnostics, which is, for example, identifying patterns in symptoms and lab results, can reduce human defects and improve diagnostic accuracy. AI can also optimize triage by analyzing patient history and prioritizing based on severity. AI implementation. So, how will AI be implemented in ER process map? And what does the future ER process mapping and expected outcomes look like? We predict that the future ER process map with AI would have patient check in, AI driven self registration kiosk, which allows reduction in wait times. We also predict triage will have AI based tools analyzing patient data. So, for example, like symptoms and vital signs to prioritize cases in real time. And then we also predict that diagnosis and treatment were really AI assisted doctors by providing diagnostic suggestions based on the patient data and medical records. So the AI in itself is just not generating false data or false results. They are generating all of the results from the patient's data and medical records. And then under expected outcomes, we expect a faster triage where AI can assess and categorize patient urgency quickly. We also expect reduce misdiagnosis, where AI can support diagnostic accuracy by suggesting possible conditions based on patterns. We also expect increased in efficiency. Automation of repetitive tasks frees up healthcare providers to focus on patient care way more than without the AI implementation into the process. Measuring success. How can we tell if the process improvement is a success? Well, we look at it in two categories. So the first one would be metrics, right? Under metrics, we would want to see a reduction in patient wait times. This is where we measure the time from patient check in to treatment. And we also look into improve accuracy in diagnostics. Track these diagnostic accuracy before and after AI implementation. And then we also really are looking into increased patient satisfaction, conduct surveys on patient satisfaction regarding wait times in care. And then the second part is tracking improvements. We want to be able to make sure that we are tracking these improvements to better collect data if the AI implementation is a success. So we track key metrics like wait times, triage accuracy, and misdiagnosis over time to really monitor where we can make and allocate improvements.
Thank you, Arlene. My name is Hannah, and I will be talking about challenges and considerations. The challenges that would come across are costs, training, and ethical concerns. With costs, implementing AI technology can be expensive, requiring investment in software and training. With training, healthcare staff need to be trained on how to use AI tools effectively. And with ethical concerns, issues like patient privacy, the potential for bias in AI algorithms, and the challenge of integrating AI with existing workflows. However, there are ways to overcome these challenges. With costs, considering phased implementation to spread costs over time. Training to provide ongoing education and support for staff to ensure a smooth integration. And with ethical concerns, use AI systems that comply with regulations such as HIPAA and ensure that AI algorithms are regularly audited for biases. To conclude our project, AI can enhance ER efficiency by shortening wait times, boosting diagnostic accuracy, and elevating patient care. There are two takeaways that we learned. Workflow efficiency in ERs, with benefiting both healthcare providers and patients. Implementation and training. This can be addressed by potential issues and making AI a valuable tool for the future of emergency care. This could also pave the way for a more efficient and effective healthcare system. Thank you so much for watching.